Safety concerns, a lack of money, and proper inspections. It's the latest into a FOX News investigation on group homes.
We first told you about this issue in November after the death of a group home patient in Mobile. Well, since that shocking story, people started reaching out to us with their concerns.
That's right. Here's our FOX10 News investigative reporter Shelby Myers with Behind Closed Doors, a group home investigation.
According to national studies, there's more need than ever for group homes in Alabama for those with mental or intellectual disabilities, and that trend is only expected to continue. The need for group homes is there, but is the support?
I've really lost a lot. I've lost a lot.
Matthew Cox, gone too soon. Court documents say the 21-year-old with autism living in a group home in Mobile was stomped to death, allegedly by his own caretaker. His family is now suing 4 companies for his death.
We hope that this never happens to another family, another child again.
A person involved in the group home industry who wanted to remain anonymous says it didn't have to happen.
They're cutting corners. Then when you cut corners, you start putting people's lives in jeopardy.
Our anonymous source says it all comes down to having less money to run the homes.
One agency that I worked with actually was paying their staff $10 an hour, but as the cuts came, they're now paying them $8 an hour. And that affects the quality of work you get, and that also affects the morale of the staff.
From 2009 to 2012, Alabama's Department of Mental Health took one of the largest budget cuts in state history, 36%. That's according to a study from the National Alliance on Mental Illness. That cut causing a ripple effect. On Halloween of 2012, Searcy Hospital in Mount Vernon shut its doors for good. Just last year, Mobile Infirmary, the only hospital in our area serving inpatient psychiatric care, ended its services. Both closing sending hundreds of psychiatric patients from controlled environments to community-based programs or group homes. James Tucker, director of the Alabama Disabilities Advocacy Program, says the need for mental health care is the same, but how patients are treated has shifted.
The number of persons who are living in group homes as opposed to living in the warehouses that existed in this state of several decades ago, of several hundred to literally more than 1,000. Naturally, when you have persons served in a different place, you're going to have more persons in the new setting.
A report by the University of Colorado shows the trend will continue. Nearly 880,000 people are expected to be in a group home by 2030. That's double the number from 2000. Since group homes are a fairly new trend, Tucker says the way they are regulated has many flaws. In the case of Matthew Cox, Trent Yates, his caregiver at the time, was able to work at Matthew's group home called New Way Out despite pleading guilty to a previous assault charge. In that case, court records say he assaulted a man so badly he was admitted into the hospital.
And I think one of the fundamentally important issues that's raised is what are the qualifications of the individuals who are hired to provide care for persons with disabilities in a setting like that.
The anonymous source we spoke to says a huge issue is in the way homes are certified. The State Department of Mental Health designates one person to certify homes in 10 counties. That means one person is checking up on 572 locations.
There are hundreds of homes in this area, and for one person to be responsible for all of these homes to see if they're doing what they are supposed to be doing is just mathematically impossible.
Our source says there used to be 2 certifiers for every 10 counties, but after those major budget cuts, there's now just 1. I made several attempts to contact the Region 3 certifier, but he never returned my emails or calls. Our source says if a home receives a score of a 90 or better, the certifier won't visit for 2 years. If the home scores an 80 through 89, the certifier visits every year. And if the home scores a 79 and below, the certifier goes back after 60 days. As the Cox family continues to mourn, they just want something to change so it doesn't happen again.
Our goal and hopes for the future is that his legacy is remembered by protecting other children and other adults in these group homes or anywhere they're at so they don't have to go through the same thing.
We filed an open records request with the Department of Mental Health asking for inspection reports on all group homes in Mobile and Baldwin counties. The department told us they would not give us that information because they say it's private information protected by health insurance portability and accountability, or HIPAA. You can head to our website, fox10tv.com. We've placed a list of all group homes and how they were scored on there.